This is how you see. And this is how a cataract patient sees. Place: Southeast Africa. In one of the poorest countries in the world. Time: July 2022. After years of darkness, life shines again on more than 1,000 people to see life again clearly after its darkness for years. Globally, there are at least 2.2 billion people who are visually impaired or blind, more than half of whom are treatable. The illness has two leading causes. One of them is a disease of cataracts, dimness of the eye lens. Cataract. A cataract is a disease that causes the formation of a liquid substance on the eye's lens, and gradually the sufferer loses sight. This disease is widely spread in poor areas, especially in African countries. It recorded more than 35 million cases. Every 60 seconds, a new child is infected with the disease. Mozambique gained its independence in 1975. After colonization that lasted 4.5 centuries. But the freedom did not change much from the state of general poverty experienced by the developing country in various fields, as the country plunged into a civil war that lasted for decades. Despite the recent high rates of economic growth due to the discovery of natural resources, there are still great challenges facing this peaceful country, especially in the health sector, including eye health services. The country has a high prevalence of visual impairment, with about 4% of 31.26 million population suffering from these problems. In addition to the inefficiency of the eye care system due to the acute shortage of doctors, and the high costs of surgical interventions. Cataracts and the infected. Most people with visual impairment and blindness are over 50 years old. Cataracts and kids. Young affected children may experience delayed development of their physical, language, emotional, social, and cognitive abilities, and may also experience lower levels of educational attainment. Cataracts and the economy. Globally, the vision impairment is an enormous financial burden, with annual global productivity losses due to the vision impairment estimated at $244 billion and $254 billion. Cataracts and the workforce. It affects participation in the workforce, productivity, and depression, and anxiety rates rise among sufferers. Cataracts and the elderly. It can contribute to social isolation, difficulty walking, higher risks of falls and fractures, and an increased likelihood of early admission to nursing or nursing homes. 1,000 cataract operations, the first stage. With a world-class medical staff, the LPE team was able to perform cataract surgery for more than 1,000 patients by 4 highly qualified specialist surgeons. In our role in promoting locality, our specialist surgeons have trained and qualified a group of local doctors to later perform their required operations on their own. Steps towards the light. The first step. Receiving patients and recording data by the hospital team and updating the patient database with each subsequent stage. The second step. Our doctors, in conjunction with local doctors, perform a preliminary examination of patients to find out the defect and determine the type of surgical intervention required. The third step. In sterile environments, our doctors begin to anesthetize patients and prepare for their required surgery. The fourth step. The surgery begins with the LPE surgical team and with the help of the local nursing staff. Each operation takes 10 to 15 minutes. After which the patient leaves the hospital and is asked to return the next morning. The fifth and final step. The next morning, our doctors receive patients, remove the eye cover and examine the patient to ensure the success of the operation. On the same day, a bag is distributed to each patient containing eyeglasses, drops, and medicines to be used after the operation. In addition to a poster with medical instructions and instructions for the patient during the upcoming period. With the end of the first phase, we have succeeded with our partners in restoring the light to the lives of more than 1,000 people and drawing a smile on their faces and families. Let's start another journey in a new place with new friends and take steps towards the light. Thanks to our partners. LPE, as local as possible.